idea has been long in the making, and it's accessible crisis services have been identified as a need by many different people for many years here in Clackamas County, by family members and police and hospitals and providers. And really, it wasn't until Cindy came to Clackamas County and started the behavioral health redesign that we could even begin to think of it as a possibility. So I have to say, Cindy, you are the main driver here, as you know. Anyway, so Centerstone is the product of many different voices, some of them naturally competing agendas, and many of them were on the crisis redesign committee. Some of those people are here today. And the model has changed with new input and continues to change, which is really a credit to the flexibility of the staff here. Because with every new situation, we realized that there's something that we didn't think of. And even though he's not here, I hope he would be here, I wanted to give a shout out to Scott Snedeker, who was on our redesign committee. He was a peer voice, and he made us read this article called Soteria and Other Alternatives to Acute Psychiatric Hospitalization. And this article is on the table over there, and it really is what changed what began as an observation room as the peer support to the peer support lounge, which is right behind this wall, and I hope everybody will get a chance to go visit, which is a huge shift in our thinking from the beginning. I also wanted to give a shout out to the Centerstone staff and supervisors, many of whom have been actively visioning this with me for the past couple of years. It was really built from the ground up, and I have to say that our staff have really uncomplainingly shifted from regular county schedules of 9 to 5, Monday through Friday, to weekends and evenings and holidays, and they did that really without complaint, and I think it's because they really believe in what we're doing here, and they are a really mission-driven group, which is just such a pleasure. I wanted to thank the Wormline and Empowerment Initiatives for their grace and patience with our learning curve on peer services, and in particular, Jim and Shannon from Empowerment Initiatives, who have really gently challenged some of our ways of thinking and have taught us some new ways of thinking about and working with our clients, and that's been so fabulous, transformative. I want to thank Susie Shank and Karen Carlin, our mental health first aid trainers, because they've really brought it home to us that an enlightened and informed community is the best, provides the best crisis care and the safety of your own home and other safe environments. The next page. Our closer relationships with the Sheriff's Department and Jail Service and Corrections and Treatment Court and Iron Tribe and NAMI and Bridges to Change and all of the other people that we're working more closely with have really benefited our folks who are struggling to make sense out of the criminal justice system and find community and support, and that's just such a strength of this building, I think. These partnerships are really magic. And in the past 2 months, we've had more success stories than we could ever hope to imagine, even in our wildest imaginings of what Centerstone could mean and what the potential is. And Gally Murray, who's one of our lead workers, asked me what I was going to talk about today, and I said I was going to say some nice things about the staff, and she said, no, you have to tell the story of Nick Lang, who is a fictional name, which is a combination of my two favorite sheriff's office people.
Hey, come on in. There's lots of room. You want to go?
So the story is we've been open for less than a month, and Nick is a young man who's well known to the sheriff's office and high on their list of concerns, and lots of contacts, and the volatility of behavior and response to police contact that really raised him on their concern list for somebody who may end up getting hurt through a need for use of force to keep the community safe. So our crisis staff, who are embedded with the sheriff's office, Heather and Dimitri, I don't know if Heather's here.
Hey.
Know her. There she is. Up
Hi,
there.
Bryce.
Attempted to engage Nick, but he really didn't trust either mental health or police, and so weren't that successful in spite of good efforts. And one day the deputies were called out again by 911, and 3 squad cars, 2 mental health professionals, tasers drawn, recipe for disaster. And then what happened next is a very typical thing in Clackamas County that doesn't get a lot of press. Happens every day. The deputies secured the scene without anyone getting harmed. Unfortunately, that's not high on the newsworthy list, but back to the story. Nick didn't want anything to do with mental health or police, and so Heather and Dimitri called the Empowerment Initiative. And up drives Spiers in his own car, and he gets out and gets briefed about what's going on in this situation. And he walks up to Nick, and he stands a little closer than anybody's comfortable with, and puts his arm on his shoulder and says something that nobody can hear, and leads him off and gets him in his car and brings him back to Centerstone, which is just a miracle. I mean, it's an amazing thing. So Gally, who wanted me to tell the story, was in the lobby when they arrived, and this is what she said. She said, Nick walked in and he stopped short, and he looked around and then introduced himself with a handshake. Clear as a bell. He said something to the effect of wow, this is great. It's amazing that there's a place like this. I've been in places that are supposed to heal, but they just make you feel sicker. But this is a good place. And on the way back home, he put his hand on the Spiers' shoulder and said, I have hope. I haven't had hope for a long time. In 2011, the crisis team received 1,741 police reports that they cheerfully screened from county law enforcement agencies, and they were sent to us by deputies and officers who had identified a mental health situation and wanted to bring the situation to our attention. What that means is that is at least 1,741 times law enforcement has been involved with a county resident in crisis and no one was hurt, which is my segue to the next.
So thank you, Martha. And Allie, are you here?
Oh, actually.
Yes. Oh, Nick. Okay, wait a minute. Okay.
No, I don't want
to screw this up. Okay, so.
No, that's okay.
So I met actually Nick when I first came here, and for those of you who don't know Nick, I can't imagine anyone does, but for those of you who don't know Nick, he does a variety of wonderful things. He leads the crisis intervention training, the CIT program, for public safety folks around the county and actually outside the county as well. Are you a deputy too?
I'm just a little bit of everything now.
Okay, he's a little bit, and he's also the police chief for Wilsonville, right?
Yep.
And I got to know him not only from CIT, but also when we started up the living situations in Villebois. And Nick was a frequent visitor to Villebois, and he's an incredible, I didn't say this when he's not here, he's an incredible partner. He gets it. He cares about what we do. He cares about humane service and caring and connecting with people in the community. And so it has been just amazing to work with him all this time. And so I'd like to introduce Nick.
Wow. Did you get that down for my evaluation? Okay. I'm Nick Watt, like Cindy said, and I've been with the county for almost 20 years now. And when I first started out, back in 1992, I think